Welcome to this video. My name is Mike Christian from VetViz Consultants. This video is about the manual confirmation of pregnancy in cattle. Local regulations vary according to region, so this video should be used in conjunction with an approved training course. The video consists of 4 sections, 3 videos, so please feel free to stop, rewind, and actually go back to bits that you want to re-see. The third and the fourth part are looking at firstly the non-pregnant structures in the live cow, and then looking lastly at the pregnant structures in the cow. When students are confident with the models and the slaughterhouse samples, we can then move on to non-pregnant live cows. The cows must be safely restrained to prevent injury to themselves or the operators. Examination of the cows in estrus when there is a lot of uterine tone is easiest for those new to the technique. If there are a lot of feces present in the rectum, or the cow is on a high fibre diet with dry bulky feces, it may be necessary to empty the rectum before examination. It is important to be confident in identifying non-pregnant structures before trying to identify the pregnant ones. The pulse of the iliac artery should be identified in either side of the pelvis in the non-pregnant animal, so as to differentiate it from the middle uterine artery in the pregnant cow. When students are confident with non-pregnant cows, then we can move on to pregnant cows. Manual rectal pregnancy confirmation is a task that can be mastered quite easily, but does require practice so the operator can identify the cervix, the pregnant uterus, and the non-pregnant uterus. If the uterine horns are fluid-filled, they are about 2 months pregnant. You can see from this chart the sizes of the uterine horns at different stages. You can see the cotyledons are beginning to develop at day 55, but cannot yet be felt. If the cervix cannot be pulled back into the pelvis, then the cow may be more than 10 weeks pregnant. This is an image of a 77-day-old fetus. If you follow the cervix down and move your hand up and down and you feel a calf, then the cow is pregnant. The cotyledons can be felt from about 12 weeks, and here is an image of the conceptus at 12 weeks. Again, using piping and tape, the middle uterine arteries can be added to either side of the enlarged uterus model. This is so that students can get an idea of where to feel for the middle uterine artery. Feeling for the uterine arteries either side of the cervix. If you can feel a pulse in the uterine artery, which is movable, then the cow is at least 3 months pregnant. It changes in its feel to fremitus, the Latin for roar, as the fetus develops. Once you can feel fremitus, the cow is 5 months plus pregnant. Do not confuse it with the iliac artery, which is not movable. If you cannot feel any of these things, or you cannot retract the uterus, or you're not sure what you're feeling, then you should go and seek professional veterinary advice. There may be other reasons why the uterus is not retracting. Also, always remember there are 3 outcomes for a pregnancy confirmation. Yes, no, I'll come back and check it again in 3 weeks' time. Hopefully, as students master the technique and as you get practiced in it, then the number of don't knows will actually reduce over time as you become confident in what you're feeling inside the cow. I hope that this video has been useful and that you'll be able to confirm that your cows that you're seeing are in calf. Thank you very much for listening, and I hope it's been of use to you.